Tuberculosis killed 1.4 million people worldwide in 2019. In 2020, the coronavirus pandemic overwhelmed health services across the world. In 9 countries with a high prevalence of TB, among them India, Pakistan, South Africa and Indonesia, diagnosis and treatment fell by an average of 23%, according to analysis by the Stop TB Partnership, a non-profit hosted by the United Nations in Geneva. They say the fight against TB has been set back by 12 years.
It's an impact on all the work that we tried to do, but also the finances that were spent, all the efforts of everyone. We are basically back to kind of square one of that time.
Like COVID-19, tuberculosis is a disease of the lungs caused by bacteria rather than a virus.
A lot of the people that are dealing with TB, doctors, nurses, healthcare workers, providers, were shifted from TB to COVID.
Hospital wards used for TB patients were rapidly converted into emergency COVID-19 units. As countries imposed lockdowns to fight the pandemic, TB diagnosis and treatment were again hit hard.
Usually, people with TB are the ones that are most vulnerable and are the ones that have a lot of difficulties in reaching the healthcare. And one of the reasons can be distance, can be money, such as poverty and other barriers. These things were actually exacerbated on COVID.
That means many patients are badly infected by the time they reach any clinic or hospital.
That's what a lot of the clinicians are saying, that they observe now some very, very bad forms of tuberculosis that they didn't see in many years. These bad forms of TB means that mortality will be higher. It also means that transmission within the household will be bigger.
Dityu says there is an opportunity to claw back lost progress. The coronavirus pandemic has forced healthcare providers and communities closer together. By combining testing, contact tracing and treatment for COVID and TB, both diseases can be tackled at the same time. Scientists say urgent investment is also needed in new TB vaccines and treatments. Henry Ridgewell for VOA News, London.